My name is Jocelyn Ramirez. I'm going to talk about newborn bilirubin screening for biliary atresia. Published analyses indicated that newborn screening for biliary atresia by using serum bilirubin concentration or stool color card is potentially life-saving and cost-effective. Further studies are necessary to evaluate the feasibility, effectiveness, and cost of potential screening strategies for early identification of biliary atresia in the United States. Here, newborn screening for biliary atresia in the United States is assessed by using criteria established by the Discretionary Advisory Committee on Heritable Disorder in Newborn and Children. Published analyses indicate that newborn screening for biliary atresia by using serum bilirubin concentration or stool color card is potentially life-saving and cost-effective. Further studies are necessary to evaluate the feasibility, effectiveness, and cost of potential screening strategies for early identification of biliary atresia in the United States. Go to the video YouTube and explain this thing.
This obstruction, or maybe even an absence, or
with the
passageway.
bile ducts or
Biliary
gallbladder.
has to do with the
So
bile.
biliary
Bile ducts
atresia
or
is when there's some sort of blockage,
biliary
deformity,
atresia
or
is when
even a
there's some
total
sort of
absence of a
blockage,
bile duct.
deformity, or even a total
Biliary
absence of a
atresia
bile duct.
specifically refers to newborns or young
Biliary
infants.
atresia specifically
And it can
refers
be
to
a congenital
newborns or young
defect,
infants.
meaning something
And
that
it can be a
happens during
congenital
fetal
defect,
development,
meaning something that
but more
happens during
commonly
fetal
it's some sort of
development.
inflammation that happens
But
soon
more
after
commonly it's
birth
some sort of
that leads to
inflammation
the
that happens
destruction of
soon
the bile
after
ducts.
birth that leads to the
There isn't a
destruction of the
definitive
bile
cause of
ducts.
biliary atresia,
There isn't a
but it's
definitive
generally
cause
thought
of
that
biliary
some
atresia.
viral or toxic
But it's generally
substance
thought that
might
some
induce the
viral or
inflammation.
toxic substance might induce the
Some genetic
inflammation.
mutations have also been suggested,
Some
like a
genetic
mutation in the
mutations have also been
CFC1
suggested,
gene, which
like a
is
mutation
involved
in
in
the
the development
CFC1
of the
gene,
left-right
which is
embryonic
involved in the
axis.
development of the left-right
At any rate,
embryonic
the
axis.
mechanisms and pathogenesis
At
are
any
still
rate,
pretty
the
foggy,
mechanisms and
and it likely depends
pathogenesis
on a
are still
combination of
pretty foggy,
genetic and
and it
environmental
likely
factors.
depends on a combination of genetic and environmental factors.
Newborns with biliary atresia usually develop jaundice.
Newborns with biliary
Since there's some
atresia usually
destruction
develop
or
jaundice.
deformity of the bile
Since
ducts,
there's some
eventually
destruction
there's an
or
obstruction
deformity
to
of the
bile
bile
flow,
ducts,
right?
eventually there's
And
an
bile will
obstruction
start
to
to
bile
build
flow,
up.
right?
Pressure in the ducts will
And bile
increase,
will
and
start
that
to
bile
build
will
up.
eventually push
Pressure
its
in
way
the ducts
through
will
the tight
increase, and that
junctions
bile will eventually
between the
push its way
epithelial
through the
cells
tight
lining the
junctions
ducts
between
and
the
leak out into the
epithelial
blood.
cells lining the ducts and leak out into
This
the blood.
increases the amount of conjugated bilirubin in the blood,
This
which
increases
leads
the
to
amount
this
of
yellowing
conjugated
of the skin
bilirubin
and
in the
eyes.
blood, which leads to this yellowing
Although
of the
not the
skin
most
and eyes.
common cause of neonatal jaundice overall,
Although not the most
it
common
is the
cause
most
of
common cause
neonatal
of
jaundice
neonatal jaundice
overall,
that's
it
surgically
is the most
treatable.
common cause of
And
neonatal
early
jaundice that's
recognition of the
surgically
disease
treatable.
improves the effectiveness
And
of the
early
surgery.
recognition of the disease improves the
Typically, the
effectiveness
surgical
of the surgery.
procedure used for biliary atresia is called
Typically,
the
the surgical
Kasai
procedure
procedure.
used for biliary
And
atresia is
basically
called the
what's done is
Kasai
the
procedure.
damaged bile ducts
And
outside the
basically
liver
what's
are
done is
first
the
removed.
damaged bile ducts
And then the small
outside the
intestine
liver
is
are
cut,
first
and
removed,
one end is
and
directly
then the small
reattached to the
intestine is
liver,
cut, and
where
one
bile
end is
comes out.
directly reattached to the
Also
liver,
where the bile ducts
where
used
bile
to be.
comes out. Also
This
where
allows
the
the
bile
bile to
ducts
drain
used to be.
directly into the small intestine.
This allows the bile to
The
drain
other end of the
directly
small
into the
intestine
small
is
intestine.
reattached to another
The
spot
other end of the
along
small intestine is
intestine,
reattached to another spot
such that
along
now
the
there's
small
this
intestine.
path from the stomach to the
Such
small
that
intestine,
now there's this
as well
path
as a
from the
path for the
stomach
bile
to the
to
small
drain from the
intestine,
liver.
as well as a path
Although
for the
this
bile to
procedure
drain
can
from the
be
liver.
effective at reestablishing
Although
some
this
bile
procedure
flow,
can be
a lot of
effective at
newborns continue to
reestablishing
have
some bile
slowly
flow,
progressing liver
a lot of
disease,
newborns
and
continue
will
to
often
have
need a
slowly
liver
progressing
transplant
liver
by 2
disease,
years of age.
and will often need a liver transplant by 2 years of age.